The Quack Quiz, proudly brought to you by Dis-Chem, pharmacists who care.
Prostate cancer, two words that fill men with dread. Cancer is one of the main health concerns men face, with 1 in 23 men being diagnosed with prostate cancer in their lifetime, and it is the most common cancer amongst South Africans. Now, besides the image of a doctor with a rubber glove, how much do you know about this manly menace? We thought we'd get Sugar Smacks into studio and ask him. Good to have you in studio, Sugar Smacks.
What's up,
you've been doing
Mike?
great,
You
man.
good?
Hey, you're single. I mean, take it easy. Just went all over the place. Tell me a bit about that success.
Hey man, that was very good for us. You know what I'm saying? More than anything, I think like it was the first time. Well, as a solo artist, it was the first time I had a single that was playing everywhere, like on every, from Ukozi FM to 5FM to Good Hope
Crossover
to whatever.
Success,
it just crossed over nicely. It's been used in TV shows, you know, as theme song and everything else. It's been nominated for awards at the Channel O's. So look, it's been a good year. The Sugar Factory has been in full effect.
That's great to hear.
Yeah.
I wanted to ask you a different question, challenging question. Strictly Come Dancing. You got some unfinished business there. Would you ever go back to that?
That was the hardest thing I've ever had to do. That's when I realized that, you know what, I'm not a dancer. Let me rap, you know. Let me stick in the recording studio and not the dance studio.
Which is great, and you know what you're strong at. So
yeah, I know. So I'm not going back here.
Well, you had more courage than I did. I haven't actually attempted Strictly Come Dancing. So, you know, good for you, mate.
No, good luck.
Listen, we're talking prostate cancer today, and it affects both of us in a big way. So you guys have done the Quack Quiz. I'm going to suggest that you, if you haven't, do it with us now. See if you can better Sugar Smacks' score. You ready for this? 10 questions.
Okay.
What do you think you're going to get out of 10?
I have no clue about prostate cancer as I sit here.
Well,
so let's see what my general knowledge will tell me.
All right, we're going to educate you as you go. First question, Sugar Smacks. What is the key warning sign of early potential prostate problems? Is it an enlarged prostate or nothing out of the ordinary?
Nothing out of the ordinary.
You're right. That was a trick question. You got the first one absolutely spot on.
That's right.
I'm impressed.
Yeah.
And I'll tell you why nothing out the ordinary. I mean, prostate cancer in the early stages has few or no symptoms. The symptoms such as the kind of need to urinate or weak or interrupted urinary stream, those are all symptoms of sort of progressed disease. So in the beginning, no symptoms at all. You're right. What size is the average prostate gland? A walnut size or a peanut size? A large peanut?
I'd say a walnut.
You'd say right. He knows plenty about prostate, all right? Third question, compared to other cancers, prostate cancer is slow growing or fast growing?
Slow growing. Slow
growing. You've done your homework. I'm impressed, man. It is. It's a slow growing cancer, which means if you catch it early, great prognosis. Okay. But if you catch it late, not so great.
Problems.
Cool.
Okay.
All right. Fourth question. Which of these lifestyle changes can significantly improve a prostate cancer prognosis? Losing weight or drinking more water?
Drinking more water.
Dude, you were doing so well up to that point.
Okay.
It is, in fact, losing weight.
Okay.
Oh, man, I'm sorry for you. I thought you were going to get a 10 out of 10 for this one. It's true. In fact, men who are overweight or obese when they're diagnosed with prostate cancer face a higher risk of actually dying from the disease, so quite significant. Okay. What does PSA stand for? Think outside of rapid jargon now. Think medical jargon. Does it stand for prostate-specific antigen or the Prostate Support Association?
Support Association.
The prostate-specific antigen. Oh, man, close.
It's getting hard out here.
All right, I'm going to have to start winking and nudging with the right answers. Now, PSA is that test that you do to test if there's any prostate issues. Okay. And what it is, it's a little protein that circulates in your blood, and when there's a problem with the prostate, that amount of PSA in the blood goes up. It's not always prostate cancer, it just means there's an issue with your prostate. Sixth question. Which of these traditional beauty treatments has showed promise in treating prostate cancer? Botox, or rather waxing, or Botox? There's a really trick question, this. Have you waxed or Botoxed?
No, neither.
So it's a tough question.
I'll assume,
take a guess.
I'll assume waxing.
Oh no! Botox! Your lips were going, I could see it. It was like, it's going to be there. No. It's Botox. I mean, it's a crazy question, but it's true. Botox injections into the prostate gland have been shown, the studies have shown that they've reduced the size of the tumor. Amazing. So, you know, let alone the wrinkles, they're dealing with prostate cancer. Interesting study there. Okay, unless you're a woman, you're not a woman, huh? Okay.
No.
Last
I checked.
Yeah, good.
I was fine.
And we're not going to check now. So, unless you're a woman, no one is immune to prostate cancer. But which of these is a key risk factor? Age or recurrent bladder infections? Age.
Age. All right. Okay.
What were you going to go with?
I was going to go with the other one. I was going to go with the recurrent bladder infections.
Okay. Well, it is in fact age. Yeah. No worries. I mean, this is great, and you're getting educated, which is fantastic, and educating the audience. They're kind of going, woo-hoo. You know, we're with sugar smacks on that. Age is probably the biggest risk factor, with about 80% of cases found in men over 65 and less than 1% in men under the age of 50. You nowhere near 50, huh? No, which is good. Ethnicity is also a key risk factor for prostate cancer. Who is at a higher risk, white men or black men? It's not how high we can jump. This is the risk of prostate cancer.
I'd say white men.
It's black men. What? Us? Really?
Ow! I never. Okay.
It's true. Black men have a higher risk of prostate cancer. It's most common. In fact, it's the most common cancer amongst black men, and the second most common cancer amongst white men in South Africa. Yeah?
Okay.
Fascinating. Ninth question. Which of these superfoods shows strong prostate cancer fighting ability? So what foods can fight against cancer? Tomatoes or broccoli?
You've been getting me out here.
Red.
Okay, tomatoes.
Yes, tomatoes. Sugar smacks, way on, man. They've got in them something called lycopene, which is an antioxidant that really kind of helps with prostate health. So tomatoes, great for prostates. Final question. With no family history of cancer, when should men pluck up the courage to have their prostates checked? Once they hit 50 or once they hit 65?
Once they hit 50.
You're absolutely right. Yes, man. And that was no whispering from the audience, which is great. Sugar smacks, thank you, mate. That is awesome. Really great.
Now we know.
No, exactly. And that's.
And can I test for it now? Or should I wait till I'm 50? Can I do it earlier?
Look, if I can get a glove somewhere, we can test it. I look forward to the next single. Can't wait. Good man.
Thanks.
Sugar smacks. Guys, I hope you did the Quack Quiz. I hope you kind of tested your score against Sugar Smacks. And if you didn't do as well as him, then I suggest you get onto that Hello Doctor app and start asking questions and educating yourself around prostate cancer specifically. We'll see you after the break.
The Quack Quiz, proudly brought to you by Dis-Chem, pharmacists who care.